Hey, welcome to the Pharmacy Residency Podcast, a member of the Pharmacy Podcast Network. We're going to have Debra Carlson on in just a minute, and she's going to do a solo episode, and I wanted to talk about a couple of things. The first is I always extend that invitation if you want to do a solo episode, talk about your residency site, or do that with your preceptor or your co-resident. I will always publish that for free. I'm trying to figure out how to support you with the interview process. The letter of intent thing was supposed to be just me helping maybe half a dozen people. It ended up being closer to 75 people that I helped. But I have that background in English, and I wanted to definitely help those that struggled with that. But kind of drop me a line and let me know how I could help you with the interview process. Right now, you can go on residencyhelp.com, and I've put up 3 videos so far about the residency interview itself, my 2 questions, and then Brian Fung's video was so good that I put a link to his as well. And then you can also see a number of audio that I have from the podcast. Now, I know that I'm on almost episode 300, and it's tough to kind of sort out which they are. So I took about 20 of the most relevant ones. And whether you are, and I set them into different groups, but how does your residency application get scored? You wanted to hear from current residents, current RPDs. What are the questions and answers that you'll hear? And of course, make sure to get our 100 Strong Residency interviews and the phone interview book from Brandon Dyson and I. I think that just being able to hear all that question, answer, rationale 100 times will definitely make you more experienced and ready to go. It's on Amazon, Audible, and so forth. But then I've also got some episodes that kind of prequeled that, where I talked to Brandon Dyson, of course, and a number of other people regarding the actual questions. But then also, what's it like to be PGY2 resident? So if you're applying to that, or even a PGY1, PGY2 combined, also had an episode there. And then something that maybe you don't want to think about, but we had a match Phase 2 success story with Key Gales, and then what's after residency. So just a ton of different audios that you can listen to while you're waiting, and I know the waiting period has begun for most of you, but that you can get at residencyhelp.com. And also something I haven't done before, but I'm doing now is I set it up that you can join the email list. So if you want to know when the podcasts are available by email, or you want to know when I put up another YouTube video, mostly you can subscribe also on YouTube by hitting the bell and the subscribe button. But I'll be putting out a ton of content this spring. Looks like my LOI content was really helpful for a lot of people. I want to say almost 2,000 people looked at that explanation of how to properly use a template and make it your own. And then, of course, I helped people make their very own unique template so they could do their 10 or 12 applications. But anyway, residencyhelp.com. Make sure you sign up for the email list, and there's a ton of audio and video there. But without further ado, here is Debra Carlson in the first of 2 episodes on managed care residency.
Hello, my name is Debra Carlson, and I am the current PGY1 managed care resident at the Medicaid Center of Excellence in Sullivan University. Today I'm going to be doing a brief topic discussion on what managed care pharmacy is and how pharmacists are a part of it. Managed care pharmacy is defined as the practice of developing and applying evidence-based medication use strategies that enhance member and population health outcomes while optimizing healthcare resources. Most often, this is interpreted as pharmacists within health plans and insurance companies trying to provide the right therapy at the right time for the right member. This is incorporating quality and accessibility of healthcare with improved clinical outcomes while providing cost-effective treatment options. Managed care pharmacy organizations generally cover populations of people, and pharmacists can have a larger impact to take care of millions as opposed to working with patients one-on-one. However, managed care pharmacy involves a lot more than just the pharmacist. There's a variety of different players within the game that all affect each other. For example, there is the patient. Obviously, they're either the member in the insurance company or a patient coming to you outside of the insurance company. There's the private health insurance sector versus public, so private being commercial health plans and public often being Medicare and Medicaid. There's also the pharmacy benefit manager, or the PBM, that fits into all of this as well, along with the manufacturers and distributors and retailers of medications. It's extremely important for pharmacists and patients to realize all of the different players within the chain of managed care pharmacy. It's important for patients because most patients don't often realize that all of the components that go into filling a prescription. For example, a patient goes into a pharmacy, they bring the script that they were given to their doctor, and they expect the pharmacist to hand over the medication. However, there are often a lot more steps involved than just handing over the script and handing over the medication. This could involve the product payment, or if the patient doesn't have insurance, how is the patient going to cover this medicine? There could be a drug interaction between the script that's handed over and a medication the patient's already taking. So there's a lot more steps involved between the process of a medication getting from the manufacturer to the end user, which is often the patient. In addition, there's often a lot of misconceptions about where the pharmacy benefit manager, or the PBM, plays a role in this chain of events. For example, one of the benefits of having a PBM is to help smaller insurance companies lobby as a larger group to manufacturers to get higher negotiated rebates, which in turn would cause less for the insurance company and then cost less for the patient. So yes, there is that part of the PBM playing the middleman. However, in the end, they are generally helping the insurance companies not only charge the patient less money, but in end be better stewards of taxpayer dollars in the event of a public health insurance company like Medicare and Medicaid plans. There's a variety of tools within managed care pharmacy that help ensure that patients are having appropriate access to medications to have the best clinical outcomes possible. These tools can include formulary development through pharmacy and therapeutics committees, or P&T committees. They also include clinical programs such as medication therapy management, or MTM, drug utilization review, or DURs. These also include utilization management, so looking at prior authorizations, quantity limits, appropriate step therapy, and these are all just kind of established to have appropriate channel management within the managed care field. So the appropriate channels could include preferred or exclusive tiers, it could include mail order pharmacy, specialty pharmacy, etc. So what are some of the roles of pharmacists within managed care organizations? Pharmacists can contribute to plan benefit design. So this is where they would collaborate with other professionals to design effective benefit structures that serve a population's needs. So whether this is a commercial population through a worker group health plan, or a Medicare or a Medicaid population. And this plan benefit design really incorporates the design formulary, how the plan is formatted, the pharmacy network that are included, utilization management, as we talked about before, kind of managing those PAs and step therapies, the member cost share, and really increasing the use of generic drugs. Plan benefit design often includes presenting recommendations to the P&T committee. So the P&T committee is often made up of pharmacists, physicians, administrators, other healthcare providers that really just improve the quality of the health plan. As I mentioned before, there's various utilization management tools, including PAs, step therapy, quantity limits, etc. PAs are generally just an approval process to encourage proper use of medications. Step therapy is requiring a specific product required before an alternative can be used, and this is often drugs within the same class that have a similar efficacy, and there may be one that may be associated with more side effects or maybe less often preferred by the various prescribers that the health plan is commonly associated with. In addition, age, checking for the member's age to ensure that the product is approved for that age limit and they aren't using drugs that aren't approved for that age limit. And lastly, quantity limits. Quantity limits are often aligned with FDA-approved dosing and can help eliminate fraud, waste, and abuse from that side. Another aspect of plan benefit design are clinical programs. So clinical programs are really used to enhance patient care and particularly focus on chronic conditions that could be associated with star measure drugs or conditions where there's very clear evidence that improved adherence and appropriate utilization can reduce long-term complications. COPD is a great example of a common clinical program development simply because it has been shown that by using proper inhaler technique, by using maintenance inhalers on a daily basis, rescue inhalers as needed, those can decrease COPD exacerbations in the future. It's no surprise that having a pharmacist on a clinical outreach team makes a difference in patient adherence and clinical outcomes. There are many studies out there that show the benefit of having a pharmacist on the healthcare team. Kind of building off clinical services, pharmacists also design outreach opportunities so they can create protocols that facilitate the exchange of necessary information between prescribers or additional prior authorization requirements. For example, pharmacists will often provide evidence-based education to providers if there's a noticeable trend that maybe a health group is treating its members differently, or if there is any updated prior authorization requirements for the pharmacy benefit. In addition, a pharmacist could work for a pharmaceutical manufacturer and be sharing new clinical information regarding a specific therapy. Maybe a drug recently got approved for an additional indication. They could be reaching out to providers to provide education around that disease state and medication, just as an example. But regardless, the main point of having an outreach team is just to have that relationship between providers and have that open channel of communication to provide better information. On the other hand, very different from clinical roles are roles that pharmacists can play in business management. Often pharmacists can contract with employers and health plan clients to structure business arrangements that negotiate discounts with manufacturers or establish networks of pharmacies, setting reimbursement rates, and really being advocates for that specific patient population. A big deal right now within the managed care space is focusing on outcomes-based contracts between manufacturers and health plan clients. And this is really, instead of having a flat reimbursement rate for a drug from a manufacturer, health plans may get additional rebates if their patient is actually performing well. So looking at the clinical outcomes of their patients and negotiating pricing and risk-based contracts regarding those clinical outcomes. So that's kind of something to look forward to potentially in the managed care space in the near future. So as you may have noticed, there are innumerable roles that pharmacists can play within managed care, and everything that we've really talked about thus far has really been in the health plan space, so working with insurance companies and variety of state plans. However, there are even more outside of that space. For example, drug information. Pharmacists can work fielding drug information questions either for manufacturers or other health systems. There's also product development, client relations, industry relations. For example, market access is a very big space for pharmacists right now. government programs, looking at health economics and pharmaceutical trends. And then lastly, specialty pharmacy is a huge space for pharmacists right now, simply because specialty really focuses on complex disease states for patients. And because of the medications and the cost and the complexity within their care, pharmacies often involve pharmacists at a higher level of interaction and education, just to make sure that the patient is aware of how to take this medication and how to be safe taking it as well. And now that we've talked a little bit about pharmacist opportunities within the managed care space, I would also like to talk about student opportunities and how students can get involved. If any of these potential jobs sounded interesting to the students out there, I wanted to provide some opportunities for them as well. AMCP, or the Academy of Managed Care Pharmacy, is really the go-to for any managed care pharmacist or managed care student pharmacist, anybody interested in this kind of field of pharmacy. Most pharmacy universities have an AMCP student chapter, so I would encourage students to get involved with their chapter. There's the P&T competition. This often consists of a fake scenario, so you're given a drug and an e-dossier that includes all of the drug information, all the studies, pricing, etc., and you have to work for a health plan or some other managed care organization and essentially decide how you're going to provide coverage for this drug. So the P&T competition really provides a good example for a common scenario that a managed care pharmacist has to kind of work through, balancing the clinical benefit of the drug, what other drugs are in that class space, obviously the cost of the medication, how many members it's going to impact. So the P&T competition is a really great way to get kind of your feet wet in managed care at a student level. The student AMCP chapters also often host networking and professional events where you can meet other pharmacists within the managed care field and maybe even serve as a leadership role within the student chapter space. However, if your university does not have an AMCP student chapter, there are many ways that you can get involved online just by being a member of AMCP. AMCP has offered a managed care pharmacy certificate program, and that kind of allows students to explore different aspects of managed care, looking at Medicare, Medicaid, the Affordable Care Act. So regardless of your situation, there's a lot of great ways to get involved in managed care and kind of figure out if this is a field that you're legitimately interested before it comes time to making a career decision as a third or fourth year student. I also want to briefly touch on residencies and fellowships. Residencies are generally a year-long intensive experience within a managed care pharmacy environment. There are accredited and non-accredited residency programs. One of the key problems in terms of being accredited for a managed care residency is the percentage of clinical services. So to be ASHP accredited, residency programs need to have at least 75% direct patient contact. And as you can imagine, this can be a little difficult in the managed care space just because there may not be as many opportunities for direct patient contact. So I think this is a key difference when you're looking at accredited versus unaccredited programs and trying to determine which one is right for you. Just trying to keep in mind, is clinical something that you're more interested in, that you would like more experience in, and just talking to the program directors and seeing if there's opportunities for you to be more clinically involved, even if they are unaccredited. Another postgraduate opportunity within the managed care space are fellowships. So fellowships are generally more research-based and can be either 1 or 2 years. Fellowships are often associated with industry positions, so working for manufacturers or larger pharmaceutical distribution companies. Another key difference between residency programs and fellowships are that residencies often do on-site interviews between January and February, whereas most fellowships do their interviews at PPS during the ASHP mid-year conference. So that is something to keep in mind if you're trying to differentiate between the two. However, both residencies and fellowships are great postgraduate opportunities to gain additional experience and hopefully make you a better job applicant in the future. AMCP has two major national meetings each year: their fall meeting, AMCP Nexus, and their spring meeting, AMCP Annual. At Nexus is often where the residency showcase is. So if residency is something that you're interested in, that is definitely a meeting to consider going to, just to get additional face time with the programs that you're looking into and hopefully answer any further questions that you have before application time starts. Hopefully I was able to answer most of your questions about managed care pharmacy and what managed care is. I often get asked why pharmacists are an asset to the managed care pharmacy team, and I always respond that our unique drug training makes us especially qualified and a very important voice in these discussions within health plans, within industry companies. I am not a managed care expert by any means, but this is what managed care pharmacy means to me and what I've seen in my experience. Thanks for listening.
Hey, thanks for listening to the Pharmacy Residency Podcast. And if you're interested in learning more about the interview process, go over to Amazon.com where you can check out 100 strong residency interview questions, answers, and rationales in print book, ebook, and audiobook.